What is holistic functional medicine? Symptom. Typically, when we experience symptoms, we are prescribed medication to suppress them. For instance, if someone has a migraine, a healthcare provider gives a pain-relieving drug to alleviate the headache. In contrast, holistic functional medicine takes a different approach. It focuses on identifying and addressing the root cause of the headache, so the pain is resolved at its source. Whole system. Often, healthcare providers focus on treating just one organ, rather than the whole body system. For example, when treating facial acne, a patient is prescribed antibiotics and topical creams to reduce the acne. Holistic functional medicine, however, takes a different approach. It views the body as an interconnected system, recognizing that an issue with one organ can affect others. It investigates factors such as diet, nutritional deficiencies, infections, gut microbiome, liver detoxification, and cellular functions. It focuses on the entire body system rather than just one organ, for a deeper and more holistic approach to healing. Gene. Cancer, fibromyalgia, hypertension, and diabetes mellitus are often seen as diseases heavily influenced by genetic factors, leading many to believe that we have little control over them and that reliance on medication is essential. However, holistic functional medicine takes a different approach, emphasizing the importance of diet and lifestyle changes to alleviate these conditions. While medication is not excluded in holistic functional medicine, it is typically reserved for severe cases and used for a limited time. Although genetics play a role, with some genes making individuals more prone to certain diseases, holistic functional medicine believes that factors like diet, herbs, and nutrients can help activate and support genes. In short, bad genes don't have to be a life sentence. Patient-centered. Last but not least, holistic functional medicine adopts a patient-centered approach to care, prioritizing the patient's goals and responses to treatment. The healthcare provider serves as a guide, not as someone who imposes a one-size-fits-all treatment plan. Unlike traditional, disease-oriented approaches, where a diagnosis often leads to the same treatment for all patients, holistic functional medicine recognizes that each patient has unique goals, genetics, circumstances, and motivations. Practitioners do not take an authoritarian position, dictating treatments, but instead, they listen carefully to the patient's concerns and collaborate on the best path forward.